doctors ni pharmacists they be ye adwuma bom school no ye ko bom kakra du baby afi ni ate yentem no mo aye mo de wo efa na ye so ye de wo fa efa pharmacists for ye enduro no enduro no ye chemical enti said ye enduro no affect ni pedua no at any point in time emun so any whole benefits whole faso ni na pharmacist no na ye n'adwuma enti doctor tra sometimes I doctor be sure no for pharmacist ebusa say we ye man ni senye ni say enti dey ye work together enti dey enti a ye trauma we dey ba pharmacist ho ni say ono na final person obe chew say do no fa ni say me ma one tablet over no one anopa wi enwumre ana we no fa na nopa ene enwumre fa no for have this number of days afi wo fa didi ansa na wafa ana me didi ne fa afi nso wo satese wo fa enye ma sei na obehu wo hu ni sei ya frame wo hu ni sei ya eye enti no eba edro no se de edro ni nipadua ni kwa relationship na wo ni nyina no e pharmacist na adwuma enu nti na ye ma prescription ye ka se fa ko pharmacist ho so hospital kwa na no be ko dispensary ho no pharmacist ho wo de ba ekrom aba community so wo be community pharmacy kwa ko to pharmacist obe church we nyina enu no se de ya hwehwe so the be ya from doctor to pharmacist to patient you know the health of the patient is at risk. Instead of the young fans so boni bia bre nipadua no enti na fasa ekwan yi mu ansa na nipa no anom.
Okay.
Aha.
Now say I know say you can say self medication. Any self prescription and so ya ben ene wo mu.
Enti asana be hu ehun sonso ye no. Ye define the ye e dey any self medication. And plenty no obi o ho a osori anopa o ene miya menya diarrhea eno aso wabora pharmacy bi o se me to we ko to Imodium no ato no anon because over the years no when who say ebi a obi call hospital no wenya diarrhea ni e ma no Imodium no fa ye ne call ye ana ni wo fa bi wo fie ni ma me bi wo fie onya diarrhea ye ma no Imodium no fa ye ne call ye enti akoye suban bi a abeka nipa bi so say o minimta metie me ya me hia para me nya diarrhea me ko fa Imodium eni ma bebre enti amebia wa wo di wo pe a diagnose wo hu say because of the symptoms ba ko mienu bi a me nya enti no me yare nie na wa wo di wo pa akoto edro abra wa woni doctor ankasa ana woni pharmacist ankasa amana ma wo eyi say okay we ne beboa wo ya sape wo ya self medication
okay
ana mpo say ebi a wonya yare bi maybe etwam nie ma wadro bi e na ofa ye ne koye e na bi yare no ho science ni sa ba bie mu no ntino why wajin say ene de wo nko doctor ho nko pharmacist o me ko ta adro na bie asano ene so ye self medication
okay
aha nti anytime bi a wo fa adro na woni pharmacist ankasa woni doctor ankasa bia you are self medicating yourself now say who so do so bebre and so only been say you find do bit say antibiotics antibiotics in dry you dey fighting infections and na Ghana hani e mai mu bebre you fight bibi e fe no antibiotic resistance because antibiotics bebre no ya far ma emwa no o ma sro bacteria na cause infections no o ma sro antibiotics ni bi so it is a way you repair na se do hospital antibiotics ni bi o ha ya go so kra ade se e fa dia no odin ni bon so odin afan yetini aso infections ni bia no it's only one of the biggest problems you faces
okay
all because of self medication with antibiotics I say so another substance also say Baby, uti na ya oya no. Nim de nti a uti ya oya. Akofa para na wanom. Na ekọ. Na asan ba biem next week. Wasa akofa biem na wanom na ekọ. Minim not long ago minim obi a ni tia ye ni ya say na blood clots in the danitrim.
Okay.
But because what for painkillers after over the time or they social anu nyina no. One call hospital my uncle fi who said dey pa na how. It is all medication so to transform say and maski yari potia e how no. Nti any say you be hu no na too late.
Okay.
Because it's science na ma one and many mu ha no what so anu with over the counter medications. It's a bedroom baby I was say yeah unyam one na too late. Aha.
Me ba cho. Me too. I'm focus say oh, edro we dey over the counter. Over the counter. Unhia prescription. Nti ene e ukọ ya na wakoto. Oya ka so bibi over the counter then.
Okay, nti over the counter medications no ye. Medications are enye purely by prescription alone.
Okay.
Nti you can say over the counter. Yeah studies over the years who say okay. A draw way no. You don't have to come all the way to get a prescription before you can get it. However, a pharmacist is in charge of all over the counter medications. It's in that yen over the counter medications.
Okay.
Yeah, place na yeah in the pharmacy regulations down. The professionals here no. Even though you are walking into a pharmacy to buy another counter medication like blood tonic and now antacid and now say painkiller, no, there is a professional in charge of the over-the-counter medication. In Ghana, Hanemepi, no, the yen say yebebusa the pharmacist. And sometimes there's a bit of a system failure because any pharmacy be asked to pharmacist.
Exactly.
And every pharmacy must have a pharmacist in charge. Even though say any pharmacist no chart it. There are so many times I will say, oh, madam, me periato. Only you won't come on you know. No one who said the over saw Barbeton, no, can you here? Aha. So even though it is over the counter, there is a professional in charge. You must always have that chat, a free consultation. Pharmacy be a busa. Can I talk to the pharmacist? No matter what you are going to buy. But yeah, before no. Question no cry na yen to kwa. Madam, na buy. If you say yes to buy, yes sir. A drug beer or to pharmacy mo je drug say dey okwa any pharmacist no enkasa. Take how make sure no. Every good pharmacist will never just sell medicines to you. There will always be one question or two. And those questions are there to assess if you really need that medication you came in for. The difference between the over-the-counter and the prescription ones is that most of the time the prescription ones, we have identified the particular need, the particular problem. The experts must prescribe. So the pharmacist can prescribe even a prescription medicine for you. And then the doctor can also do that. Most of the time, chronic medications, hypertension, diabetes, and then who need diabetes, don't mean diabetes is a drug. Don't mean hypertension is a drug. We've done further studies, we have identified that this is your particular situation, your condition, now prescribe amount. But over the counter, no, we call things like we have something called a simple illness of common occurrence. Common cold and flu, common stomach conditions like first aid medications. But even with that, always seek the professional advice before you purchase them and turn up. A drone.
Okay. Na say bia me yare mako hospital o ma ye test amame. Omo adekwa ye me. E no ma tro eduro na amame akọ ama pharmacist. Ahwe eyi eduro na amame. Na ebia prescription ne kire say eduro no menom anopa ene enwumre. But me hwen so a se menom na anopa ewia ne enwumre a e na me feel good wo me body mu. And also no self medication ni bia.
And then no abuse drug no. And then you drug abuse. Drug abuse. Drug abuse na nyɛ nko ani omo ya trauma ni these other addiction medications no. We say I catch you say fano anopa ni enwumre na say fano anopa nko a. Na the way I feel fine, you know. Why would you pay say me the mefano anopa we enwumre. You are abusing the drug.
Okay.
Because studies na who say a draw we no ufa ne ba ko a eye.
Okay.
Ufa bro for you say the side effect. A draw bia e won side effect.
Okay.
Even common para you will number of tablets a ufa would be 3 hours ka obewu. Automatically be shut down with kidneys.
Wow.
Exactly. Into a draw ni ya mu hwehwe who say a draw no body no. Your mouth this strength milligram of this a draw in a day okay. A bro so pay not just a side effect na a draw no be my body no. Mana more. And a draw be also be a draw be a poison. Oh, every drug is a potential poison. And you know, ye de ma no say de akasa fa no or so fa no pepe. One fan say they are ufan below enye adwuma na e wo say ye no ufan more so a wo be ha body no more
nanka me ba ma asem so am be bisa say how dangerous is self medication self prescription say ebetumi ekun say bia eduro we e bia condition we a wo no ene eduro we emfa enti no usu wunnim ena wakwafa anka me baba bisa say how dangerous ena ye ena me other question ye then na ye tie self medicating on pa e wo Ghana ha.
Okay, and see how dangerous no. Number one, the serious danger
okay,
and I say is damage, organ damage. Most of the time in dry air fan, either say liver nuna excreting about bunting, a better liver nima appear, and now say kidney no, and the baby who you ma fan appear. And you know, so we continue to self medicate on the particular medication. We want to say now liver I say, and I say kidney I say, na ko fancy so baby bro. A bit to me, a double heart to me fat pet, na o skin. And so be go at once.
Okay.
And so to me, it's so severe and serious. Say, no within a few hours, it can kill you. As I said before, no, it will be a potential poison. And you know, the danger of it, media, it do over. Meaning, sometimes maybe they didn't get their medication, they took a different one, and then just because our condition be that
yeah.
And I will say this condition doesn't go with this medication. It's a local fire, necessary emergency. It is very dangerous. It can lead to death. It can lead to organ damages. It can lead to disabilities. There are people who are taking medications and afterwards their eyesight were affected. After who are debut. Obi so fire man raw medication na ma ni na bubu ye ntimi ananti bi ntimi no de dangerous ni de dose
now
dose bebre
what kwaya pharmacist is eduro bi wo hono ma any eduro bi enhia to say bi amfa ne say we example I don't know say bi ambeka say bi paracetamol ene folic acid enhia nti bi a onom para untumi nom folic acid bibi sa ho
endro ni na endro bebre ni ada endro enhia
okay
me for no be what experience I don't say endro bi wo ha ye trauma na ko pharmacy pharmacist ne dey ma obeka say o endro a wo fei so wo fa any antacid men fa no at the same time
okay
fa no be after 2 hours of where do you wo fei Aha. Tell me, you saw example of antacid. Ions make chemicals be more. So we fa indrobia absorbing. If the air absorbing, that means a drone what do na uhiano enye jumano. Aha. And then drobio on swa. And my other endro anu so ye de more.
Okay.
It's a be how. A lot of medications, no. See the amount say even to go how baba na prescription no there's a drug for ne also. E be catch say we no ufa we ya train after 1 hour na 2 hours after na wafa this other one.
Okay.
Aha ni nyina no pharmacist in the betimi aye dey a check we nyina depend on the dry dey amount.
Okay.
Aha. Interactions media a dose. A lot of BP medications, no, any indobebe interactive.
Okay.
A lot of diabetes medication, indobebe reactive. A lot of antibiotics. And that's the why the more you say men show. Because yes, and we avoid the sun for the next 7 days or 14 days. A do go why the more you say men farm milk, men dicosia.
98.9.
For the duration now, drone. All these are interactions. Any a drone qua embo and pediano. Intina, aha, that we need now.
Yare ben
And
I walk Ghana ha, you try self-medicating.
Inti Ghana Hano. Self-medicated a year, very common pa your painkillers.
Okay.
Painkillers number 1. Because nipa no nya body pains no mami gibido mami diclofenac. Aha, and the most common because sometimes you don't need the painkiller. You know how then the serious say stress be na manity ya. If all you need is some rest.
Okay.
And you will be fine. But if you no akofapara. And now people don't realize sometimes they get addicted without even knowing. And now most times, though when you have some serious injury, you man a drug to say tramadol.
Okay.
In a very low dose. Now a fat. And then the doctor and prescribe now. What say we won't say offer and feel good. We pay no coy for the next, let's say 3-4 days.
Yeah.
I say, or two things I could be our own wakoto. Such medications, it easily leads to addiction. You get addicted to it because of the good feeling it gives you.
Yeah.
I say, go answer why you're addicted. But to me, change, so call pharmacy back who say, you're able to infection the brain to alcohol, no, call another area, no, the old prescription. Now, what that's so far, no, that's so far. Because of the pain relief and the good feeling. It's about painkillers there, yeah, be seen pa. It's a lot. Obi on so when we didn't mention paracetamol. It has serious effects on the liver. It's about no new routine check at some point, yes, or liver issue and a kidney issue.
I know
many one of them.
You better lady pharmacist Vera Owusu-Fordwouh we'll find out what Obeka for a year self medication prescription.
The final words I send back to Mambo so. Most of the time memo hani Africa hano. A lot of the reasons are nipa abuse syndrome and that's almost self medicating financial issues.
Okay.
It be or G or share Uncle hospital, Uncle Tia, Stika, and Sunline. Some doctor be who know by doctor so by a double chairman a drone into that.
Okay.
If you are doing the financial, the cost of the unity out, so you know, bedroom, I mean, and after the entire routine checkups.
Okay.
The entire and Kafina Sono, Nanka Konwa check it, Ubody no near who. Baby, I told him, Nanka, ya saw no mountain. In your entire they may advise me say, sometimes, you think you are cutting, the corner.
Yeah.
But even if the financial issue is a problem, when you enter the pharmacy, always engage the pharmacist. We are there as the first point of call in the community. On the hospital, no, a hot community pharmacy, so your adults say engage the pharmacist. They are also well-trained health professionals. They can help you to get the right medications for common, illnesses. Found quite serious, emergency situations. Always engage the professional at the pharmacy and get the right medications.